The House Appropriations Subcommittee on Health and Human Services will come to order. Clerk, please take the roll.
Chair Morse.
Here.
Vice Chair Martis.
Here.
Representative Hood. Representative Brabeck. Representative O'Neill. Representative Puri.
Here.
Representative Farhat.
Here.
Representative Price.
Here.
Representative Skaggs.
Here.
Representative Snyder.
Here.
Vice Chair Green.
Present.
Representative Bolin.
Here.
Representative Meerman.
Here.
Representative Kuhn.
Here.
Representative Steele.
Here.
Madam Chair, you have a quorum.
Thank you, Clerk. Rep. Price moves to approve the minutes of February 21st, 2024. Seeing no objection, the minutes are approved. So welcome today to our hearing on community violence intervention. This has been something that I have been working on, actually, trying to expand knowledge about what's happening across the state. We have conducted town halls in several communities, including on the east side of Detroit with Rep. McKinney, in Saginaw with Rep. O'Neill, in South Lansing with Rep. Hope. I had one in Kalamazoo. We had one in Kent County with Rep. Glanville. And I think that's all that we've done so far. We are currently have one in planning as well for the west side of Detroit. And the goal behind that was, as many of you know who are here today, the state decided to invest in community violence intervention from a statewide level for the first time with the Supplemental 23 Appropriations Bill. So what that bill did was it set up a statewide office, which is still being put together, as well as invested $10 million in community violence intervention and gun safety work. So we wanted to go and talk to the communities that are especially hard hit by community violence to find out what are those community orgs and governmental orgs that are working in the space. What are they doing? Why are they doing it? Is it evidence-based? Is it not? Have they gotten funding from any source? Really just so we have a more complete understanding of where we are now and where we should go with this. We've only invested, there was an additional investment in the 24 budget. It is my belief that this investment should continue long beyond my tenure because this is not a problem that's 2 years or 3 years in the making. It's many decades and beyond in the making. And I'm really excited to have the people here today outside of the department who will advise us on what's happening. But everyone that we are having here today, we heard from in the process of our town halls. And they are all people that are actively working in community violence intervention. And the reason that community violence intervention is so important, even though it's a very small percentage of our very large budget, is that its impacts ripple throughout our communities. And it's got many different reasons. There are many different ways to approach it. And we've heard, in these different communities, what they think we need to do. And a fair bit of it is revolved around social determinants of health, disruption of violence by trusted community partners, and love, interestingly, and a feeling of hope. And especially our juveniles feeling like they have a future in the community. So with that, we are going to ask the department to come forward to present the work that they've been engaging in so far. So we have Dr. Sarah Lyon-Callow and Amy Epke from the Department of Health and Human Services. Welcome, and just make sure you turn on your mics.
Good morning, Chair Morse and members of the subcommittee. We're glad to be here today. My name is Amy Epke. I'm the Senior Deputy Director of Financial Operations for the Michigan Department of Health and Human Services, and joined by Dr. Sarah Lyon-Callow. And as the chair mentioned, we're really excited to be here today to talk about the community violence intervention and really appreciate the legislature's support in the 23 supplemental and the 24 budget for the initial investment of funds. We're going to talk a little bit today about what we've done with those funds. There was a very competitive grant process that we utilize, as well as establishing the office within the department as well. We know these are initial steps and there's more to be done, and we really appreciate the chair's commitment to this issue as well as the rest of the committee. So with that, I'm going to go ahead and turn it over to Dr. Sarah Lyon-Callow.
Thank you, Amy. Good morning. I serve as the Senior Deputy Director for the Public Health Administration. Yep. Is this better? Okay, sorry. I will lean in more. Thank you. Good morning. My name is Sarah Lyon-Callow. I serve as the Senior Deputy Director for the Public Health Administration. I want to thank you for the opportunity to share update on the department's progress into interventions in preventing community violence. Community violence, which includes homicide and non-fatal shootings, causes substantial harm and trauma to communities across Michigan, especially in racially segregated and historically disinvested neighborhoods. People who live in communities experiencing violence are at higher risk for developing chronic diseases and may have limited opportunities to engage in healthy behaviors, such as using recreational spaces and accessing healthy food outlets. Community violence interventions are non-punitive, community-led strategies designed to interrupt the transmission of violence by engaging those at highest risk to provide individually tailored support services. CVI supports local organizations and leaders to prevent violence and reduce adverse outcomes in their local communities. Although any community can experience violence, each community looks a little different, and strategies will need to match the needs of that particular community. DHHS has received funding for activities in FY23 and 24, and we want to thank the legislature for this support. And I want to provide an update as to our progress since we were first funded. I'm going to share information on the Community Violence Intervention Advisory Council and our grant-making activities. But first, I did want to introduce our CVI Office Director, Ms. Jennifer De La Cruz, who's over here behind me. Jen has worked in public health since 2009 and has been leading our public health efforts to prevent domestic, sexual, and other types of violence since 2015, including community violence prevention. Jen has maintained longstanding relationships with communities implementing strategies to reduce violence in the state and has been participating in community listening sessions with the DHHS team. Her role to lead the CVI office will advance strategies to enhance community safety in Michigan. DHHS has formed the Community Violence Intervention Advisory Council because we never do this work alone. The council will participate in the development of the state CVI strategic priorities, assist DHHS in connecting with additional partners and sectors in this work, and provide feedback on CVI initiatives. This council was formed in November and includes members who are local experts from organizations such as, but not limited to, the Saginaw Community Action Center, Genesee and Washtenaw County Sheriff's Offices, the Michigan State University School of Public Health, Flint Public Health Youth Academy, Force Detroit, Southwest Ministerial Alliance, and the University of Michigan's Institute for Firearm Injury Prevention. The council has met twice and will meet in March to set up their governance structure. In April, the council will begin developing strategic priorities to guide the focus of the council and the CVI office, and we hope we'll have those priorities finalized at the end of the summer. The CVI Office and Advisory Council are supported by appropriations from the legislature. In FY23, supplemental appropriations of the Federal American Rescue Plan State Fiscal Recovery Fund provided $5 million in one-time funds for grant making and $800,000 in one-time dollars to establish the office. Fiscal year 24 appropriations included $5 million in one-time grant funds, general funds for grant making, and $800,000 ongoing general funds for the Office of Community Violence Intervention. The department is very appreciative of funding for CVI and has moved rapidly to get these grant funds into communities. I'm pleased to share with you that $2.5 million of the FY23 funds were used to strengthen existing programs already conducting community violence interventions in the state. This support was provided to programs in Wayne County, as this county has the highest homicide rate and has higher rates of poverty, lack of access to transportation, and crowded housing. Current activities include expanded specialized case management, workforce development, increased street outreach and engagement, mentorship, geographic data mapping, and transformational healing for those at the center of violence. In September of 2023, MDHHS released a request for proposals to communities. These grants allowed for 21 months of activity, and organizations could apply for up to $1 million. 28 applications were received, with requests totaling more than $26 million. Applicants were reviewed by a panel, including community-based non-MDHHS reviewers and MDHS staff. Each application was reviewed by 3 people. Both work plan and program implementation, as described in the application, were important in that review. Applications needed to demonstrate that the proposed work used evidence-based and/or evidence-informed CVI strategies that are community-driven. Applicants also needed to demonstrate that they partnered with organizations which had prior experience implementing violence prevention strategies in the community identified in the application. We awarded a little over $7 million in funding to the 8 organizations listed on this slide. Activities will be occurring in communities in 11 counties across the state. Examples of planned activities are in the areas of case management for victims and/or perpetrators, street outreach, and employment and job training programs. So no one should live in fear of violence in their community or their home. In Michigan, there are 15 firearm mortality deaths per 100,000 people each year, and this rate is increasing. In 2022, nearly 1,500 people died from intentional self-harm in Michigan, and more than half of those deaths involved use of a firearm. 3% of Michigan high school students have shared that they carried a weapon, such as a gun, knife, or club, at least one day on school property during the last month. We're very pleased to have gotten the available FY23 and 24 funds out to the community, but there are more areas needing support. MDHHS is requesting a proposed investment of $5 million in one-time federal ARPA state fiscal recovery funds to support community violence intervention grants in 2025, and $500,000 in ongoing general funds to continue to expand the efforts of the office. So thank you very much for the recognition of the importance of community safety in holding this hearing today and other activities that you've held. If there are questions or requests about this hearing, please reach out to Sharday Burton. Thank you.
And we can certainly take any questions at this point as well.
Well, thank you so much for that presentation. We do have a question from Rep. Green.
Thank you, Madam Chair, and thank you for being here and obviously putting this whole section of the department together. On your second slide, community violence intervention, the first bullet point gives us some specifics. This is my 6th budget working on this, and this is the first time I'm hearing a phrase, historically disinvested neighborhoods. Can you define what because I have in my mind what it is. I mean, you look north of the Knuckles, there's been no investment north of the Knuckles. So can you define to me what historically disinvested neighborhoods is?
So we make use of measures regarding historical poverty rates, levels of wealth in the community, home ownership, things like that.
Well, I think, and this is coming from me, but things like redlining, where people in Black neighborhoods did not have access to mortgage funding, for example. It's something the federal government did back in the 60s or 70s, and that still reverberates today because you have an extreme lack of investment in those homes and those communities for decades. So that's part of it. Any other questions? Rep. Rayback.
Thank you, Chair. I appreciate it. Thank you all for being here. I'm interested to know, and actually really excited about the development of the office, and I'm wondering about the advisory council and their input. And frankly, there's an idea about adding to the office in terms of critical incidents teams and kind of looking at this, like what's happening statewide around those? Because it varies so much by municipality and maybe even county. And I'm wondering about any thoughts about having that be part of the Community Violence Intervention Office.
Great question. So I think, overall, as we look at the council, we're going to be looking at what the right balance is in terms of, obviously, we want to make sure we get that input from the communities. As Dr. Lyon-Kale mentioned, the community needs may be a little bit different based on the community, but also helping to identify how we put together an overall strategy, which may include some of the ideas that you've
Right.
talked about as well, too. So I think part of our goal really is to listen and hear what those issues are and have that council help form what that direction and that strategy may be as we go forward.
Okay, that's really helpful. Maybe I can touch base with Ms. Dela Cruz as well about that.
Rep.
Yeah,
Price?
and-
Oh, I'm sorry.
I could just add one thing. I do want to make clear that we work although the office is sitting in the Public Health Administration, we work very closely with policy and the other parts of the department that are involved in
Wonderful.
those teams as well.
That's great.
Yeah.
Thank you. Thank you, Chair.
Rep. Price, go ahead.
Thank you, Chair Morse. Thank you for your presentation. Wondering if you could talk a little bit about the connection between people who live in violent communities and chronic health problems and the connection that we see and that you address there.
Sure. So we'd be happy to provide more information about particular studies on that, but we see that areas where we have community violence, we do also see higher rates of chronic disease, including within Michigan. And if we think about chronic disease prevention, the ability for access to fresh fruits and vegetables, being able to maintain a regular diet, being able to exercise are so important in all of our ability to maintain our best selves, our best bodies. And if you are unable to make use of your community freely, you're unable to take advantage of those opportunities.
Rep. O'Neill?
Thank you, Madam Chair. Thank you for being here today. I have a myriad of questions, but I won't ask them all right now. But I'll just say, when you talked about disinvestment in communities, what contributes to violence, well, I would first say poverty is like the number one factor. Lack of resources, whether it's education, lack of support for families that are trying to work two jobs to make it, take care of, all those factors. And then when you look at communities in terms of, who really deserves those funds, I'll just use my own community as an example. Saginaw. Saginaw is systematically and consistently been in the top 5 of some of the worst crime statistics in the country. Long-standing. And so, I'm happy to hear that there will be additional funds available to be distributed, because I was kind of like, wow. We had a listening tour, we had community stakeholders, and everything was laid out. And off the top of it, the community that really is in the top 5 of worst crimes in the country didn't get any funding. So I'm looking at this list in terms of who got funded on the first round, fine. But some of these programs are, probably long-standing institution programs like foundations. I'm not sure what these programs are doing on boots on the ground. So that's another part of my questions in terms of, I would like to get, for us collectively as a group, get a list of the folks who made the decisions. That would be one. The criteria I see is 3 or 4 lines in terms of what was used to determine the disbursement of those funds. And so also, having folks on those committees that have experience or coming from those environments, that have a lens that they can say, okay, this group may not be large operationally, may not have all the bells and whistles to implement $1 million, but they may have connection with a community foundation that can be the fiduciary or a city. All of those factors have to be considered. And also providing technical assistance to groups that may be in that small scale but are doing boots on the ground type work with these young men in the communities, 14, 15, 16-year-olds, to try to prevent that pipeline. I chair corrections, so I see a lot of that in juvenile justice. You know, I've been in this for years. So the pattern that we see in those communities is it starts from poverty, and it trickles all the way through the whole process of lack of resources, lack of access, and so kids resort to what they know in the environment. So, but the whole process, I think, needs to be looked at in terms of providing support for those groups that need help. And the E-Gram system, from what I understand, was pretty arduous trying to get through and navigate. That was a problem for some of the organizations that I know. And also taking care of the access of, you know, capacity. When you say capacity, that's different for different communities. And so you got to have somebody with a paradigm, with a lens that can see and distinguish varying degrees of capacity. One level of capacity, you may say, wow, they need the funds. On another perspective, the capacity may not reach that threshold, but still the same, that community still needs support, okay? So just in general, you know, we have to really make sure, and I know these funds were in the hands of the department. And so for us as legislators, I think this is something we need to think about moving forward. Not just this type of pot, but pots in general. Because we are on the ground, we are working out in our districts, each are unique. We have to make sure that these dollars and dollars that we allocate go to those programs and services that really need it, that we know they need it, okay? So that's just a statement for us as elected officials, as legislators of state dollars and tax dollars, to make sure that we keep our hands on the pulse and make sure these programs that really need it get the money. So, Madam Chair, I'll pause right there, but thank you.
Did you want to make a response, or?
Sure, I'll just make a brief response. I think we definitely appreciate all the comments and agree with you. I think through some of the other investments in the budget too, you'll see our commitment to assisting families and some of the poverty issues, because we agree there's more to it than just this component as well. And also appreciate your comments on the grant process. I think, you know, this was our first round, but we're always open to input in terms of, you know, if we should be using different criteria as we go forward and what that looks like, and having that evolve as we go forward. And then specifically also on the E-Grams issue as well, we've heard that a number of times. We are actually, our E-Grams contract will be expiring in 2025, so we do need to go through a new request for proposal process. And we're going to be holding a number of listening sessions with grantees and applicants to get their feedback on how to make the process simpler, because certainly we want to make that process as simple as possible. So we can certainly share more information with all of you in terms of upcoming listening sessions and opportunities as well.
Thank you, Amy.
Thank you, thank you.
Go ahead, Rep. Raybeck.
Thanks so much. I just wanted to follow up on Rep. O'Neill's questions. Can some of the grant money be used? I mean, there are some, to his point, and this happens, I think, in different silos of this work. There are funds that can go directly to programs that are, you know, kind of steeped in our communities, or ones that are further ahead. Are there funds set aside for capacity building?
So the one-time dollars that we received, we got out into communities. However, the role of the Community Violence Intervention Office is also to provide technical assistance. As we ran the RFP, we did have a session where people could get some technical assistance in terms of responding to that RFP and getting E-Grams help and that kind of thing. But going forward, the purpose of having a public health approach and putting the office in that public health realm is to make use of those convening skills. Pulling, just because you're not funded doesn't mean you wouldn't be included in trainings and capacity building activities that are occurring. I think there's so much expertise within Michigan, and it's really important that those voices are sharing across the state with each other, in addition to learning from, you know, other communities across the nation. So the point of the Community Violence Intervention Office is to provide technical assistance, and part of that technical assistance is capacity building. We do this frequently in public health, where we recognize there are places of need where it's really important that we enable communities or organizations working within communities to be able to respond to our offerings.
Thank you. Thank you, Chair.
Well, I think we as a legislature understand that we're standing up something that doesn't exist. So you're creating it from nothing, or maybe there's other models you're looking at other states. But at the end of the day, you know, there are so many needs in this space, so you do need infrastructure, and you do need organizations that have experience with grant writing and, you know, handling and taking on this level of funding. But we want to make sure those community orgs that are on the ground doing the work, you know, are also benefiting from the fact that we're investing in this, because I mean, in almost every case, they're volunteers, and, you know, but they're also risking their lives. So that's the thing that we don't want to get lost. We know it's going to take some time to get the system to where we need it to be, but I think what we all would like to see is in the future that, you know, these community orgs are getting the funding. And it's just hard when you see the grants come out and, you know, they're $1 million. I have confidence that these groups that are getting the $1 million are putting it out into the community. We just can't see it because we don't know. You know, we don't, and hopefully we will get that information. But I think that's just sort of like where we're hoping we go, and we know we have a ways to go. So we're allowing, you know, there is grace for what we're doing. We just want to make sure that those groups are benefiting from it. Rep Hood will be our last question on this, and then we'll move on.
Hi, thank you for allowing my question, especially since I'm not physically present. I am curious why the department determined to establish these funds and a 100% focus on Wayne County. I was a big advocate for these funds being included in the DHHS budget, and there was no legislative intent to limit access to these funds to Wayne County only. And I'm also curious, as a second part of that question, what needs to be done to expand the availability of funds to communities across the state that are struggling with gun violence. Of course, gun violence impacts families throughout the state, not just in Wayne County. Thank you.
Great question, and I'll start that off and then turn it over to Dr. Sarah Lyon-Calo. So just as one clarifying component, there is a portion of the $7 million that was put out for RFP. The $2.5 million that did go to Wayne County was to build on existing programs, and that was based on some of the factors that Sarah touched on in her presentation in terms of the high needs and the high risk, and I'll ask Sarah to talk a little bit more specifically about those issues.
So the $2.5 million that we put out out of the FY23 supplemental was directed to existing programs in Wayne County. This is because Wayne County has the highest homicide crude death rate in the state. We also saw that there was a high rate of mortality among African Americans and also among those who were 20 to 29 years of age. Wayne County also experiences some of the highest rates of poverty, lack of access to transportation, and other kinds of issues that definitely result in part from historical disinvestment in those communities. So it was the first $2.5 million is what was put out through those existing grantees. That's the only part that was limited to a Wayne County geography. The RFP itself was statewide in nature.
And if I may ask a follow-up, were funds distributed outside of Wayne County? And in the future, again, what needs to happen to make sure that perhaps it's that we did not have enough funding in the account? Would additional funding help to ensure that communities outside of Wayne County have access to violence prevention funds?
Yes, it is at our intent To the first part of your question, 7 million was administered or granted outside of Wayne County through that request for proposal process, and we would anticipate with future funds, we would have the request for proposal process, or certainly if there were certain amounts that were appropriated by the legislature, we would align with that as well.
Okay, thank you so much to the department for being here to testify and your work building something. We appreciate you. Next, we invite Aaliyah Harvey Quinn, founder and executive director of Force Detroit, and Christopher Ford, advocacy and campaigns manager for Force Detroit. You just have to make sure you hit the button that says mic there.
Thank you.
And you can go ahead when you're ready.
Thank you to the chair and honorable body for allowing us to present on our work. I was first introduced to community violence intervention inadvertently about 15 years ago as a young artist and activist. I was teaching poetry in Detroit's North End neighborhood and pushing the young men that I worked with, who mostly wanted to be your average rapper, to write beyond tropes. On this day in our writing session, I asked them, "What are you afraid of?" And one of them said, "I'm afraid of who I become when I have to help my mom pay the rent and I end up robbing people." This young man was 15 years old. He was still in middle school. His shoes were always dingy. His white tee was always yellow. I wish I knew then what I knew now. I wish I had the strategies and the resources, the wraparound services to really help him without criminalizing him. When I digged into his application and tried to reach out to his mom to offer support, the only number on his program application was to the local McDonald's, where she worked part-time. She was the mother of 4 children, of which he was the oldest, and he felt like the man of the household. I never saw that young man again, and I was never able to help him. But that was a disruption in my career. And, all these years later, now I know how to help. So federal advancements in the adoption and resourcing of public health approaches to violence prevention, along with consistently high rates of violent crime in Detroit, have reignited calls for solution. In 2021, the Biden administration announced an investment in community violence intervention to quell national historic rates of violence. He rolled out the White House Community Violence Intervention Initiatives, naming 16 cities for target investment and allocating more than $484 million in federal resources. In response, dozens of cities have begun to invest in and adopt these community-driven, evidence-based approaches to violence reduction, including Newark, Seattle, Los Angeles, Memphis, Baltimore, and Miami. CVI uses evidence-informed strategies to reduce violence through tailored, community-centered initiatives. These strategies can predictably yield between a 20% and 40% reduction in violence when implemented correctly, but they have the potential to yield extreme safety successes of up to 70%. One organization in California touted a 66% reduction in violence in Richmond, California, and another claimed a 51% reduction in Oakland, California. These multidisciplinary CVI methods with incredible life-saving outcomes are based on engaging individuals and groups at the center of violence, so people behind the gun and in front of the gun, and providing access to mental health support, transformative services to prevent and disrupt cycles of violence and retaliation. They link those most likely to commit and/or experience violence often the same category of person, with trusted messengers who have walked a similar path and are connected to resources that save lives, address trauma, provide opportunity, and improve the physical, social, and economic root causes of violence. CBI can be thought of as a culturally appropriate outreach method for providing resources that transform the traumas associated with violence. This meaningful outreach and life-saving transformative support, including cognitive behavioral therapy, job readiness training, basic needs assistance, emergency relocation, case management, consistent outreach, and more, can require a significant investment. Some national evidence-based CVI models can cost up to $30,000 per participant. However, a study conducted in Stockton, California on an evidence-based CVI program found that for every dollar spent on a CVI program, the public received an investment, a taxpayer investment, in return of between $47 and $123 in savings. These returns came in the form of reductions in investigative spending, incarceral spending, crime scene cleanup, decreases in emergency room trips, and the like. There is a huge and often invisible public cost of the failure to reduce violent crime. In Detroit, according to a 2019 study produced by the National Institute for Criminal Justice Reform and the Live Free campaign, each homicide cost Detroit taxpayers between $1.6 million, and each non-fatal shooting cost taxpayers an average of $1.1 million per incident. A serious investment is necessary to quell gun violence, but although the investment is high, the failure to invest is even higher. To make our city and state freer and safer, Force Detroit is advocating for budgetary allocations for CVI, such as HB 4606 and HB 4605. Thank you to this body for passing that, including a specific allocation of $3.5 million in the upcoming DHHS budget specifically for Force Detroit towards deepening the outcomes that I'll share with you in this proposal. We're advocating for long-term funding of the Michigan Office of CVI within DHHS, deep public-private partnerships within community and public officials to inform CVI strategies at the highest of levels, and investments in organizations like Force Detroit, to many of your questions, culturally competent organizations acting as the intermediary between the grassroots leaders that are very much so driving the strategy and the organizations and institutions that have the ability to fund and document this work is critical. Providing the necessary technical assistance, training, coordinating third-party evaluation, and collecting monthly documentation records, and also redistributing philanthropic dollars. This is a necessary role in the ecosystem. Organizations like Force Detroit should be investing in the leadership capacity of our state's grassroots sector of safety activists to develop and lead hyper-local CVI sites that emphasize the credible messenger model. Force Detroit is working to establish a freer and safer Detroit through these steps. We are working to establish between 2 to 3 CVI sites in the next 2 years to confirm proof of concept. We've already got one. We've got, as of yesterday, a 72% reduction last quarter in our community safety increase, save lives, less humans with bullet holes in their bodies. We want to develop citywide systems for ease of disseminating wraparound services. The wraparound services are the critical component that support long-term healing and trauma mitigation, and also things like third-party evaluation, And we're excited to partner with the City of Detroit on the Shot Stoppers initiative and other neighborhood safety and increased CVI investment opportunities. The City of Detroit has recently invested $10 million over 2 years of ARPA funding in a CVI initiative called Shot Stoppers. This investment resources 6 grassroots organizations, each to work within different CVI zones. Each zone is a targeted 3.5 to 5 square mile radius neighborhood. Each zone is a part of a community that has a history of grappling with high rates of violence that strategy after strategy after strategy has not been able to reduce. This is an exciting initial investment in building the much necessary life-saving support that's necessary. This initiative has been so successful that Detroit is celebrating a nearly 60-year low in rates of violence. Violence is down throughout Detroit more than 30%, but in some historically high violent neighborhoods, violence is down more than 70%. This is our neighborhood, Forest Detroit's neighborhood. I stand before you today knowing what made that success. We built relationships strategically. Less than 2% of our community is the folks that need to be targeted for these initiatives. They are the 2% that are directly engaged in violence, the people that are either in front of the gun or behind the gun. And targeting this very small population, we've got 41 families engaged, with a total, 41 families in total with messages of hope, relationships with OGs that love them, and very concrete wraparound services like cognitive behavioral therapy and relocation support in the instance of a safety crisis. But the most important metrics to us are the human ones. We've got 5 permanent relocations that we're proud of. We've got 105 hours of mental health therapy for our fellows. We've got 31 violence-impacted families that benefited from a steady stream of direct cash assistance. So that was a total of $3,000 over 6 months. We've had 87 interventions. This is 87 instances of people who have suffered with the direct impact of violence and the consequences of their conflict, telling a younger version of themselves something like, man, you don't want to go to prison, or you do realize that people know where your mama sleeps, right? Don't make that move, you're not thinking straight. And importantly to me, as the executive director of Forest Detroit, we've got 2,160 hours of staff crisis intervention training so that our team members have the right set of skills to make it home at night. A few points of clarity here. One, this work is relationship-based, and that means the fact that it's hyperlocal is important. A plan for scale should include funding more organizations and training more credible leaders, not building bigger organizations in which holding meaningful and deep relationships would become harder and harder. A 5 square mile radius is a tiny plot of land, but if you want to make a large impact with a public health violence reduction strategy that is relationship-based, it is the right size. The 72% reduction that I mentioned earlier is within a very small area. This strategy, again, it works because less than 2% of our community members actually fire guns. This means that there is a concrete list of folks, people who we know, names, our neighbors, that we can get together in a room and actually offer them support to move out of trauma. And then I think somebody asked the question about how we advance these strategies beyond Wayne County. And here's what I will offer to that. Everybody is credible in some area, but this strategy worked because people choose to put down guns and begin transforming their lives. For this strategy, we need to hire organizers to find people who are credible with community members who are directly behind or in front of guns. These are transformed, violence-impacted people or carcerally impacted people, but they're not always in suits. They're not always familiar with Google Suite, and they're not always our favorite activist friend. And no, our favorite activist friend might be deeply culturally relevant, but not with the people who are behind or in front of the guns. I'm not the right target person, right? But I'm the right person to find the right person. We need to find them, train them, fund them, support them, aid them with the infrastructure as needed, and develop non-hierarchical relationships with them. And then the last thing I would offer is that it would be tempting to invest in a single strategy or a single leader, but I would urge us to remember that CVI will be stronger as an interconnected web of organizations that form an ecosystem, working together across neighborhoods to prevent violence and share best practice. Thank you.
Thank you, Director Quinn, for your incredible work. Christopher, you can have like a minute or two, but we still have quite a few people to come testify, so if you wanted to add something briefly.
Really quick, Alea, she touched on the fact that this is not an initiative that is just germane to Michigan. The fact that in the Build Back Better initiative, Biden allocated $5 billion towards CVI initiatives nationwide. And the reason why is cities around the country that have implemented these initiatives have seen more than a 40% reduction in nonviolent and violent, non-lethal homicide shootings, and lethal as well. So one thing that I wanted to really say is this is not just something that would be germane towards Wayne County. This is something that we would not only be able to take the lead on making sure that lives are saved and preserved, but we'd be an example to the entire country on how we can get to, and I know she said this number, and I didn't see too many faces react to this, 70% reduction in the city of Detroit. That's unheard of. So I just wanted to say that this is something that we can make a massive impact in our state, but nationwide, they follow our lead.
Well, and I agree with you because we did hear that, in other communities that we went to. And especially, I think the piece about the credible messenger is really something that needs to break through because sometimes there's pushback there. Yeah. Because just as you said, people don't like the person that it might be, but that's the person that the community trusts, and that's the person that understands what it's like to live, and want to make a different choice, and encourage people to do that. So, and that's really what seems to make a huge impact in addition to the wraparound services. So I'm going to allow for 2 quick questions, but I really appreciate the work you're doing is incredible, and I can't wait to hear where it goes. So Rep. Farhat.
Thank you, Chair. I would be remiss if a group that does so much good work in my district, I did not plug them in very quickly and say thank you for doing the work. Thank you, and thank you. Because this is risky, too. People forget these violence interrupters put their lives on the lines when they go into these communities. Yeah. So I just wanted to ask, you see the turnaround of these young men and women, how you touch their lives, how they go from potentially participating in violent behavior, from throwing away years of their lives to now being transformative, productive members of the neighborhoods they live in. Can you talk about maybe some of the success stories or the economic prosperity that's come from the interventions that you and your folks are doing? Just very quickly. And again, God bless you for the work.
Yeah, I appreciate that. I think our whole team is an example of how this work develops and builds you. Specifically, DeJuan Kennedy, he was hired as an organizer to work with me to build a directly impacted team of organizers to organize around this issue. And instead of doing that, he built out a CVI site. And he is the person that is leading the 72% decrease in violence. And he did it by building strong relationships. We've got people that consider us a part of their family. We've got folks that call us for emergencies. It's highly relational. It's there are structures in place, but there has to be room for the human, the emergent need, the you know, all these things. And so, like, when I look at DeJuan Kennedy, he recently graduated from the University of Chicago's CBI Academy that's sponsored by their crime lab. He graduated in the White House. And we were invited to the White House to celebrate I forget what safety bill it was that was recently had some advances in gun violence. Anyways, he was rejected. He couldn't come into the White House because of his past record. And yet it is him that can advance the strategy, right? It is him and his peers and his friend group that can advance the strategy. And so most recently, when he graduated from the CBI Academy, it was at the White House. And that was 2 years later. And so when I look at him and I see like how he's growing and developing as a leader in the space, I'm just tremendously proud. He's learning nonprofit infrastructure. He's leading the site more and more every day completely without my support. And so I'm grateful to see it. We also hired a young person on our team that we met when they were in an altercation and DeJuan took a gun from him. We hired him on our team, and he is now leading our recruitment retention strategy and our social media strategy. So he's showing us how to like build relationship with his peers and helping us bridge relationships with people that my otherwise older adult team wouldn't know. Yeah, thank you.
Well, unfortunately, we have to move on. We have more questions, but I'm going to ask the members of the committee, because we have a number of presenters coming. I'm so sorry. But if you have questions, we can forward them to Force. Thank you so much for your work.
Thank you for having us.
You're welcome. Next, we're going to welcome Dr. Paul Alam of Advanced Peace Lansing, and he is also the Chief Strategy Officer for the Michigan Public Health Institute.
Good morning. Good morning. Thank you, Rep. Morse, and thank you for the opportunity to come and share a little bit about the work that we're doing here in Ingham County, Lansing. My name is Paul Elam. I'm Chief Strategy Officer at MPHI. We are a Michigan-based, nationally engaged nonprofit public health institute created by the Michigan legislature to support public health initiatives here in our state. And at MPHI, we really believe that gun violence is a threat to public health. As we know, due to gun violence in our community, citizens continue to pay the high price for gun-related crimes. And the reality is that our taxpayers spend a vast amount of money for what happens after a gunshot actually occurs. And so crime scene investigations, as Aaliyah mentioned, hospital bills, costs, court costs, and prison costs are things that we should be aware of as we continue to decide where our tax dollars will actually be spent. The National Institute of Criminal Justice Reform conducted research to answer how much does this threat actually cost our community, and it's estimated that a homicide costs about $1.6 million as a result of a gunshot, and about $1.2 million every time an individual is actually shot due to prison costs and other costs associated with that. And so we believe that we can do better. And we believe it's going to take a multi-pronged approach to prevent gun violence in our communities. And so MPHI is partnering with Advanced Peace. My colleagues Freddie and Maurice are here with me today from Advanced Peace National. We're also partnering with the Ingham County Health Department to establish a evidence-based CVI strategy within our region. It is called the Peacemaker Fellowship. And what we have observed based on research throughout the country is that this strategy has been able to reduce cyclical and retaliatory gun violence by over 40% once it has been implemented with fidelity within a community. Ingham County implemented this same strategy in October of 2022, supported by federal, county, city, and state funds, and we have also begun to experience a significant reduction in cyclical and retaliatory gun violence since that launch. Our first 12-month report showed that we were able to reduce cyclical and retaliatory gun violence by 65% here in Lansing. Fatalities dropped by 65% after 1 year of implementing this particular strategy. We have enrolled 15 individuals into a Peacemaker Fellowship who were actively involved in gun violence prior to enrolling in that fellowship, and 11 of the 15 has ceased and desisted from actively engaging in gun violence. 2 of the other 11 were apprehended and incarcerated for behaviors they engaged in prior to joining the fellowship. 1 fellow no longer participates in the fellowship, and 1 fellow actually has been arrested and charged for new instance of a gun-related incident. And so 11 of the 15 are doing very well. What is Advanced Peace? It is a part of an ecosystem of multiple nonprofit organizations who are doing work here in Ingham County to address gun violence and its impacts on those who are at the center of that violence. Our goal is to reduce this type of behavior by 40%. By 2025 within our region. We're well on our way to doing that. And our goal is to expand that fellowship from 15 individuals to 60 individuals this calendar year. We have insight and intelligence that about 85 individuals within our county are actively engaged in this type of behavior, and our goal is to engage every last one of them and invite them to join our Peacemaker Fellowship. To be specific about some of the outcomes we've seen since the launch, in addition to the 65% reductions in gun-related fatalities, we've seen that shots fired, calls are down by 4%. Calls to 911 or police about shots are down about 4%. Non-fatal shootings tend to be flat at this point because our intervention is targeting the southwest sector of our county, and we're beginning to expand that work throughout the remaining 4 sectors within the county. And we need to understand that our street outreach team is actually making contact with individuals who have not been contacted by law enforcement, the human services system, nor have they been employed for many years. And so Advanced Peace is spending time to make contact with these individuals. The team spent over 1,700 hours engaging in 565 different ways with these 15 fellows that we have engaged. If we weren't a part of their lives, that number would be 0 because no one else is engaging them within our community. In the past year, these fellows participated in 113 cognitive behavioral therapy sessions, 202 life coaching sessions, 88 job readiness sessions, and we've provided them with 17 different internship opportunities. They're meeting with elders in their community, and they're also receiving day-to-day mentoring and life skills development. We actually are able to feed and travel with these individuals to show them that there's a life beyond grabbing a gun daily and waking up and trying to murder someone within the community. The research shows that these community violence intervention programs save local municipalities, healthcare systems, and our legal system millions of dollars for each gun-related incident, and so we think the work is also cost effective. Based on these initial results, we have plans to expand this particular fellowship from the southwest side of Lansing into the entire city, into our high schools. We're working with the superintendent to make sure that we have a presence within schools. We're working to make sure that we have a presence at after-school sporting events, football games, basketball games, and we're in the process of having conversation with leadership in the city of East Lansing to expand this strategy there. I believe community violence intervention programs like Advanced Peace are bringing about meaningful change. They're making us safer. They save federal, state, and local tax dollars that are spent at the back end of these shootings, and preventing 1 fatal shooting can save us $1.6 million or more. Gun violence is the leading cause of premature death in the United States, and the American Public Health Association has identified it as a public health crisis. We need more effective programs in our state that will place the high cost of gun violence as a priority to help create safer cities. Our initiative is currently being funded by the Department of Justice, the Michigan Department of Health and Human Services, Ingham County, and the City of Lansing. and we're pursuing resources from the Centers for Disease Control. We do have a 3-hour forum this Saturday. Anyone is invited. It'll be live streamed. That information is posted on advancedpeacelansinghingham.org. Thank you.
Thank you so much. Thank you to Advance Peace for what you're doing. I do have a quick question, Dr. Alam. It looks like the Michigan Public Health Institute was one of the awardees of the grants. Can you elaborate on what you plan to do with the funding?
Absolutely. We are using those resources to support the expansion that I briefly mentioned. And so our initial resources targeted the southwest side of Lansing because that was the prevalence of where we were seeing gun crime. All of that information is mapped and shared on our website in a very transparent way, so you can see from a GIS perspective where the gun violence occurs. We have engaged that part of the community, and now we are beginning to identify the individuals they're feuding with, which reside on the southeast side and more so on the north side of the city, as well as youth who are moving into the city of East Lansing. And so we've secured state and federal funding to help expand our strategy, and those resources will help us move into our high schools as well as into the north side of Lansing.
Okay, thank you so much. That's very helpful. And I just wanted to note that when we talk about credible messengers, that's exactly what Advanced Peace Lansing is, correct? That's what we're talking about, people with trust in the community, and that's who's going out and doing the work and putting their lives at risk. Any comments? Quickly?
Yeah, that's definitely correct. You hit it on the nose, as well as what we call an LTO, license to operate, where they're able to get into those cracks and crevices that nobody else could get into with the youngsters. And as well is leading the way, right? Not having one foot in, one foot out, just strictly transitioned over. I'm a national trainer, so I train the NCAs, what we call the neighborhood change agents, and give them the tools and the fidelity of the work to make sure that we're hitting it on all cylinders. It's not easy because of the trust level with these youngsters, right? So the people that we have a very strategic way of hiring, interviewing these individuals to make sure that they have the tools and they got the right state of mind, that they're all the way right before they could get into the community and try to deal with the youngsters as well when they're definitely dealing with trust issues. So the credible messenger is definitely a priority in our organization to make sure that we're 100% on the right track.
Rep. Morse, if I could add to what Freddie just shared, not only do we vet the actual street outreach workers, we vet the organizations that lead this work. And so we do a full community scan of the organizational capacity and capability to do this work, manage dollars, account for those dollars, make sure that the resources are going to support what we call fellows and participants in our initiative. So we take this very seriously.
Well, thank you very much. And I just would like to note that you are also a member of the Community Violence Intervention Council that's working with HHS, correct, Dr. Alam?
Correct.
Yes.
I was recruited to be a part of that.
Well, wonderful. Thank you so much. All right, thank you so much for your testimony today. Next, we are going to call up Brandon Davis, who is the Director of Oversight and Public Accountability for the City of Grand Rapids. Oh, I'm sorry, he's on Zoom.
Good morning.
Good morning, go ahead.
Thank you. I'm joined by Eric Brown of the Urban League this morning. And first of all, we just are grateful for this opportunity to provide this update on Cure Violence here in Grand Rapids. We can go to the next slide, please. Thank you. So the Cure Violence initiative here in Grand Rapids began because members of the community came out and they told us that they wanted to see us do something different. They wanted to see us approach violence in a different way. The Cure Violence model is based on the World Health Organization's approach to reverse the epidemic spread of infectious diseases. So this model uses 3 proven strategies to stop violence. So one of the most important strategies, and you've heard this throughout the testimony today, is the use of trained, culturally appropriate workers to interrupt the transmission of violence, to prevent its future spread, and to transform community norms. So This model has been replicated in many diverse settings across, really across the world. But one of the things we've seen in Grand Rapids is a reduction or a correlation to reduction in violence in our target area. And we'll talk a little bit more about that. Next slide, please. So the model utilizes three strategies. That strategy includes detecting and interrupting potentially violent conflicts, identifying and treating the highest risk individuals, and mobilizing community norms or change in community. And when we talk about interrupting the transmission of violence, we're talking about really working to prevent retaliation. So whenever a shooting occurs, trained culturally appropriate individuals in our target area go to try to prevent retaliation in those situations by working with victims and friends and family members to navigate those spaces. They also work to keep conflicts cool. And what we mean by that is that workers follow up with conflicts for as long as it's needed to help navigate those situations and help keep those conflicts down. Then they also work to mediate conflicts on an ongoing basis. So our workers identify ongoing conflicts and they talk to key community members in order to navigate those spaces. They also work to reduce the highest risk, or they work with individuals who are at the highest risk for violence, and that's on both sides of that, right? So we've heard that language being discussed as on both sides of the gun. There's an assessment period or assessment space where our violence intervention workers work to assess who are the highest risk, who are at the highest risk for committing violence, and who is also at the highest risk for being the recipient of violence. And they work to change those behaviors in those spaces. They work to engage those high-risk individuals to convince them to essentially reject the use of violence. And the next part of that is also providing treatment. And we talk about providing treatment. What we're really speaking of is that case management space of it. That's where our outreach workers work to provide those wraparound services, because we understand that the social determinants of health are very similar to the social determinants of violence. So in those spaces, our violence intervention workers or our outreach workers, they work to minimize the impact of those social determinants. What are we talking about? Well, we know poverty is one of the highest social determinants of violence in communities. So our partners at the Urban League, our outreach workers there, they work in workforce development. They help individuals find employment, stable employment, in order to begin to work through some of those spaces and ultimately reduce the risk of being reengaged in violence, whether that's as a victim or a perpetrator. And then the last category is changing community norms. And when we talk about changing community norms, that includes responding to every shooting in our target area. That means that our violence intervention workers are in community. They are boots on the ground on a day-to-day basis. They use their social capital to engage with members of community to respond when there's shootings. And we often talk in community to explain that this is work outside of the police department, right? This isn't, we don't downplay the work of the police department, but our outreach workers, our violence intervention workers, their responsibility is not to do what police are doing. Their responsibility is to get in at a different level. So this is a both and approach to violence reduction in community. And that's one of the things that makes this such a strong model. Our violence intervention workers are not working hand in hand with police in a traditional way, as in providing information to police, but at the same time, they're not working against police. They have a common goal in reducing violence, but they go about reducing that violence in different ways. That includes working to organize community programming like basketball games, which has been something that's been super successful in Grand Rapids, but also helping others by facilitating other type of programming. And then it's also spreading these positive norms, creating a new normal in our target area to help reduce that violence. Next slide, please. So as we continue to talk about, one of the most important parts of this model is the use of credible workers. Now, Cure Violence hires and trains violence interrupters and outreach specialists who already have the trust of the community members in our target area. And that's the important part. Oftentimes, when it comes to hiring, we want to hire someone in a suit and tie. We want to hire someone that speaks the language in the way that we speak the language, but that's not what's necessary for these programs to be successful. We need individuals who already have credibility in community. So oftentimes, these are individuals who have been violence impacted on one side of the gun or the other, and they're able to influence change and behavior in community. they have the background life experiences to make a difference. And I'll provide one example of a such situation. So we're now in our third year of the Cure Violence program in Grand Rapids, and we've seen great results. And Mr. Brown will talk some about that. But one of the examples that always stands out to me is the negotiation of a peace treaty that occurred where our violence interrupters were able to bring together two rival gangs and navigate a space where they sat in the same room with no weapons and discuss the issues that they had, discuss the nature of what was going on, and they came to an agreement. They made essentially a treaty that they would no longer engage in violence against each other. And that's something, first of all, that wouldn't be the way the police would approach that work, but it's also something that a police or even myself would not be able to navigate. It took credible workers. It took individuals who already had community's trust to be able to navigate that space well. And that's something that we're really proud of related to the work that's being done by Cure Violence. Next slide.
Brandon, I'm so sorry to interrupt, but we are quickly running out of time. I have 15 minutes. I have 3 more people that are here to testify. Can you just sort of wrap up your highlights in a minute? We do have your PowerPoint. Everybody has it, so they can follow up with you if you have questions. But if you could sort of wrap up in a minute or so, because unfortunately we have to move on. So sorry.
Sure. So given that, I will turn it over to Mr. Brown to wrap up.
Okay, thank you. So then we have Eric Brown, who is with the Urban League in Grand Rapids.
Okay, I think I'm unmuted. I think everybody can hear me now. I was held down. So I'll be real quick. Thank you, Rep. Morris, for being able to give this opportunity. So basically, Brandon talked about our hyper focus of having a very small target area within our ward, our third ward here in Grand Rapids. We were able to see, if you go to the next 2 slides, please. Basically, I don't know if I'm being heard, but I'll just guess I'll keep talking. Yeah, there we go. Keep going down. Real quick, 1 more, 2 more, sorry. Right there. We'll see that we were able to see in our over the course of 3 different fiscal years for the city, which were really 18 to 20 months of our operation, that we had a 14% decrease from 2021 to 22, and then another 18 or so percent increase actually if we were looked to fiscal year 21 versus 23. So after 20 or so months of actually being within the community with our workers, boots on the ground, we were able to see about an 18% decrease in violent crimes, aggravated assaults, 86% decrease in homicides, and we're happy to say that as of this year, right now, we have 0 homicides in our within the city, not just in the target area. The next slide will show that we are on a trend to continue that over that period of time. The rest I'll leave in the report, as I know we're short on time. One reason why it is here at the Urban League is because we're able to provide wraparound services that everybody spoke of today. That includes things in our slide, as well as resources to housing, education, tobacco cessation, and more. So with that, I will land the plane, and we're happy to be in partnership with the City of Grand Rapids to decrease the crime here within our target area. We have been asked, we had 1 target area in our the 3rd ward. We have 3 wards here in Grand Rapids. Because of the early success, we've added 2 more target areas within the city, within the other 2 wards.
Thank you so much, Eric. I'm really sorry to cut you both off, but that is, vital information. And I think what we're seeing here is, it might be different organizations, but there is a lot of consistency across these different metro areas as to how they're addressing community violence. So really appreciate the work of Urban League. And we will be watching Cure Violence's success in Grand Rapids with what you're doing there. We're going to invite up our next presenter. It's Pastor Kareem Brown, who's with Healing Engagement Love Presence, or otherwise known as HELP, and he's from Saginaw, so welcome. And you have about 5 minutes. Thank you, Pastor.
Can you hear me? All right, great. And I thought he was going to bring the proposal up. I saw him put it. All right, so my name is Pastor Kareem Bowen. I happen to be from Representative O'Neill's district. We are the youngest brother on the I-75 corridor, Detroit being the big brother, then Flint, and then Saginaw. Often overlooked in many ways. Saginaw is a community that is, like many communities here in Michigan, we have forged through very tough times as it relates to the pulling out of companies like General Motors, leaving our communities devastated, communities that have been ravaged by drugs and crime and alcohol. As already noted, Michigan has issues with crime. Saginaw, as noted earlier today in earlier conversations, ranks in the top 5 with most violent issues that happen in our community. Just really quickly, and I'm going to stick to that 5 minutes. My background is born and raised in the city of Saginaw, matriculated through Michigan State University. I decided that I was going to become involved in sports. I wasn't tall enough or skinny enough to make that happen, but I started a sports management company that I worked for 18 years, working with notables from this area, Jason Richardson, throughout his entire career, as well as Draymond Green, then turning him over to his current management company. I've worked with organizations in every one of the cities that my guys have been playing that were working in community violence intervention. I heard someone refer to statistics from Stockton, California. I was a part of a community violence task force and sat on a panel in Richmond and Oakland communities, some of the highest violent crimes. You're talking about going to the mall with military soldiers with AK-47s. We sat and we went through those programs that were making an impact and how that would happen. Then again, in Phoenix, Arizona, a border city that was dealing with extreme crime and violence. Once again, in Charlotte, West Charlotte, dealing with the issues that were there, an organization called M5, a Guatemalan gang that were literally killing people and finding bodies in parks that were decapitated. Then I spent that time working with other organizations in Philadelphia. The reason I'm telling you this is because representation matters. Who you have at the helm of your organization and what they are able to bring to the table is necessary to understand the impact that they're able to make. With the programming elements that I've done over the course of my career, I started a program called the Man Up Forum, which is one of very few programs that has had the opportunity to stand in partnership with President Obama's White House doing a co-branded 5-city tour across the state, across the nation, starting in Los Angeles and ending in a Congressional Black Caucus partnership. So when we talk about community violence and we talk about evidence-based program, evidence-informed programming, that's where I'm coming from. Help Community Violence Intervention stands for Healing, Engagement, Love, and Presence. What I love about this, and you've heard the statistics, the way Impact Help makes a difference is always the same. We understand what works, we understand what's necessary. What's different about this organization than anything that I've ever heard anyone else say that has been here is that this organization is, in fact, what this money was used for, that was proposed for. This is a grassroots organization. It started because black men in the community, who have often seen black men dying at the hands of guns, decided that enough was enough. So I met with our city mayor. We then met with our chief of police, and we said, listen, we're going to get 10 guys together who are from the streets. We talk about messengers who are credible. These individuals were people from very different ranges. We now have about 60 black men who have volunteered their time, who continually volunteer their time, starting first with youth programming. The last time we met was on this past Saturday, and this is the dichotomy of what we deal with in our community on a daily basis. We had over 100 black teens, young people from the ages of 12 to 22, that were a part of our organization that came in for training on conflict resolution and critical thinking. We also have a partnership with the YMCA that provides recreation. In the 4 hours that we were spending with those young people, when we came out, there were 3 murders that happened in our community in that same time. If you're talking about if we need the funds are necessary. What we have been doing since our implementation in June of last year is not only have we been doing mentorship program, but we're attacking the issue as a public health crisis. We are partnering with State Representative O'Neill, with the Department of Justice, with other organizations. We created and put on the largest expungement clinic that took place last year throughout the Attorney General's office within the state of Michigan, having so many people that we had to turn it away and schedule another date, which will take place in May. We've been working very strongly. These are statistics. I won't bore you with those. You know what they look like. You know what they sound like. We're meeting with individuals trying to make these things happen. The individuals that are part of our group are men that some of them have been in prison over 20 years and now are out, viable, reputable people in the community, business owners. Some of them are clinicians. Others are like myself, who are entrepreneurs and working in the community, a number of pastors. We've been doing listening sessions, all of the things that are necessary, hearing what the community wants, hearing what young people want. We did a youth summit that was about how do we make an impact that really impacts your life, taking that information and making change happen. That's a little bit, I understand, and I'm reading the room.
I'm
I
so
certainly
sorry.
thank you for your time.
Yeah, I so appreciate you being here and your incredible work. I really enjoyed the town hall in Saginaw. I really loved your message and what you're trying to do there. Again, it's a critical component of reducing gun violence, and we all should recognize that it is indeed a public health crisis, whether we can declare it as such or not. But I really appreciate what you're doing. And everyone, you have the information. You can reach out to the pastor for more information should you like it, or us. We're happy to provide it. Rep. O'Neill has a quick, literally very quick, because we have one more person.
Very quick. I just want to say, Madam Chair, that I met with Forrest a couple weeks ago. And just an initial conversation, I knew about him, heard about him. And so what's going to happen is Forrest is going to work with Saginaw, okay? That's going to be a partnership that's going to be established. So that's why it's vitally important that resources are afforded so these partnerships can happen. So thank you, Pastor Kareem. Thank you, Forrest, for your support.
Fantastic. Thank you, Rep. O'Neill, for sharing that. Thank you, Pastor Bowen. All right, and finally, we have Beth Berglund, who is from my neck of the woods, and she is here as Director of Public Policy and Strategy for the Michigan Transformative Collective, which has been part of the group that has been putting together Kalamazoo's Blueprint for Peace, which is based on, she's got it in her hand, it is based off of Milwaukee's Blueprint for Peace, which is an entire plan around how we're going to address community violence, specifically in the Kalamazoo community, but it can be something that other communities could take and develop it for themselves if they haven't already done it. So Beth, take it away.
Thank you, Representative Morse. I know our time is short, so I'm going to skip some parts of my talk. We are a Kalamazoo-based, engaged community members, stakeholders, and leaders in collaborative efforts to address the root causes of gun violence and advocate for policy reforms to address systemic racism, promote equity and justice for all communities. In 2021, Kalamazoo declared gun violence a public health crisis, and from that point until last June, the community came together to identify goals and strategies to create a plan to address long-term gun violence. This plan is called the Blueprint for Peace. I'll skip that. Some of the recommendations are emergent responses, but some are long-term. Some are funding early childhood education, finding housing, creating wealth for communities who haven't had access. A lot of these recommendations in emergent response include strengthening the capacity and funding of local violence interventionists, providing trauma-informed care for the community after an incident, and developing hospital-based community partnerships which provide wraparound services to victims of violence. The grants from the state, whether through DHHS, state police, have all been funded by one-time federal dollars, and the state needs to find ways to fund these programs long-term. All of these presenters that you heard from, they are all doing in-community violence intervention. What you haven't heard from is the opportunity to provide long-term funding for these through Medicaid. Medicaid can be utilized as a permanent source of funding for community violence intervention and prevention programs through two approaches: street outreach, like the programs you heard about today, where street outreach interventionists' time can be reimbursed by Medicaid, and hospital-based interventions, which outreach workers connect with victims in order to reduce the likelihood of retaliation and provide outreach to witnesses and families after an incident to connect them to behavioral health and other services. As a partner in developing the blueprint, our hospital system was the initial impetus for our organization looking into this issue. 7 other states have passed legislation allowing Medicaid to reimburse services involved in violence prevention, and Michigan can also implement reimbursement without legislation through administrative benefit services and waivers. I'm not a CVI expert, so I'll leave technical questions to the folks in the room who are, but I have experienced multiple instances of gun violence while I was living in Chicago between 2014 and 2018, and with your indulgence, I'd really like to share with you a particular instance, if it's okay.
We literally can't. We have to end
My son
now.
last year wrote
Beth,
about, okay,
We will try to make that available for people, but we have
Okay.
session starting, so we have to end.
Okay.
And I do also have to note that we had Julie Lopez from Crime Stoppers of Flint and Genesee, who wanted to put in a card that she is supportive of community violence intervention funding and efforts. I'm sorry we can't have further discussion. We don't need to. Okay, so at this point, having no further business, the committee will adjourn.
thanks.